My name is Nenadovich. I'm an orthopedic surgeon at Lakeshore Bone and Joint Institute, specializing in surgery of the spine. I trained at the University of Chicago Hospitals and did my residency there in orthopedic surgery, and further trained in Syracuse at Upstate Medical University for a fellowship in spinal surgery. I've been in practice at Lakeshore Bone and Joint Institute since 2006, so roughly 10 years. I started out in college in aerospace engineering, but it didn't fulfill my needs to want to help people. It was a little too abstract and too dry as far as material is concerned. I did some rotations during a summer off with my pediatrician and really enjoyed what I was experiencing. Eventually ended up with an injury myself, with a knee injury playing soccer in college. Ended up needing surgery and really opened my eyes to the field of orthopedic surgery at that time. I'd say the thing I like most about the field of medicine, in particular orthopedic surgery, is seeing people get better. One of the unique attributes of being an orthopedic surgeon is that we're able to fix people. We're able to get them better and get them into a condition just like they were prior to the injury or close to it, so we can see them recovering from that injury. I specialize in surgery of the spine, including the neck, middle, and lower back. These conditions include traumatic conditions, pathologic conditions such as tumors, degenerative conditions such as arthritis, and things like disc herniations as well. One of the questions that is typically asked of me is, well, what differentiates me from other surgeons? Something that you probably wouldn't expect, or an ironic answer to that would be, is that I'm not a real big fan of surgery. I think patients can do quite well without it, and most patients don't need it. There's a lot of things we can do without surgery to get them better, including physical therapy, medications, rest, activity modifications, and sometimes even injections. Patients typically come to see a surgeon when there's neurologic deficits associated with injuries to their neck, middle, or lower back. Patients often come in with just neck or isolated neck and back pain complaints, for which there are many treatments as well. But usually we see patients that have some form of neurologic deficit or problem. Typically when I'm not working, things I like to do is spend time with family and my children. Getting out of the house and doing sporting activities with the kids is something that I really enjoy doing. Typically there's not a lot of time in a busy career, so you really have to balance, professional time with family time, and it sometimes can be a difficult task. I think what makes Lakeshore Bone and Joint Institute different or better than our practice is the comprehensive nature of the practice and our staff. Physicians and surgeons at Lakeshore Bone and Joint Institute are subspecialized, coming from some of the best universities in the country, including Harvard, Cleveland Clinic, University of Chicago, Rush, and others. We do have quite a wide variety of fields represented at Lakeshore Bone and Joint, including orthopedic surgery and the different subspecialties such as hand, joint, spine, and we also have physicians that specialize in pain management, rheumatology, and physiatry. Occupational injuries are a common injury that we treat here at Lakeshore Bone and Joint Institute. Typically, these are younger patients who have heavy labor jobs and often are injured on the job due to the nature of their work. We like to treat these patients like athletes. We like to try to get them back to work as soon as we can to avoid any significant deconditioning. I prefer seeing these patients earlier so that they get the right diagnosis and the right treatment, not because they need surgery, and frequently they don't. Over 98% of our patients don't need surgery. But I do think that having the right diagnosis early on gives them a better outcome and a shorter recovery time than if we're treating the wrong thing to begin with. It is always better to have these patients back to work at some light duty responsibility so that they're used to going back to work. If surgery has been recommended, it's quite common to get a second opinion. This is to ensure that the correct diagnosis and the appropriate surgical procedure has been advised. If you'd like a second opinion, I'm happy to see you. Please contact me at the number below.